Hello everyone. This is just a video to check in and touch base with students as we are entering into or completing or getting close to the end of week 2. These are important tips and reminders as well as really talk about where you should be right now in the course. First, I'm going to start off with some housekeeping things and then talk about where we are in terms of the course and in the areas that we've covered thus far. The first thing I want to say is thank you for the students who dropped into Virtual Office. It is very important for you to drop in if you can. It's completely optional. VO is good because it helps me keep you supported as you're in the class. It helps me understand any challenges that you may be having or misunderstandings. If there's any challenges that with the content, for instance, one student told me that one of the website links weren't working, and so I was able to delete that so that wouldn't confuse other students as well. But you dropping in VO really helps me customize the class to meet your needs, even though we have a large class, but really hear some feedback and try to incorporate that when I can to the course to give you the experience that you're looking for. So in that aspect, it's very helpful. It also helps me clarify misunderstandings that students may be having. And my thinking is that if one student has a problem, other students may have a problem. Or if one thing or a couple things are unclear to one student, it might be unclear to other students. So you dropping into VO is helpful for me because it helps me make your learning experience the best that it can be. So please consider dropping in. There was a problem with the Blackboard Collaborate link this week, and I got error messages as well as other students. So moving forward, I'll probably be making the Virtual Office by way of Zoom. So that may cut down on any technical problems that we may be having with Blackboard. Again, moving forward, we'll probably be using Zoom for Virtual Office, and I'll make sure I send that link out to students every week, or I'll attach it to the Blackboard week so that you'll know and hopefully make things easier for you. As a reminder, please make sure that you click on everything. So the main areas, you want to make sure that you've covered all the content in week 1, all the content in week 2. That's the folders, your readings, and so forth. Please, it is very, 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 very important that you click on every single link to at least familiarize yourself with the content in every single week. All of that is meant to help you and support you. You may do a reading, and in a reading you may feel that you didn't understand a concept well enough. If you click on some of the videos, maybe the videos will help you understand what it is you were reading earlier. And so again, everything is in the weeks to help you. You may have questions about assignments that are already uploaded. Okay, and so please be mindful. There are statistical tracking in Blackboard, so I can tell which student clicked on what item in any given week and or even in the course content. In the left tab on Blackboard, there's also a course content tab. Please click on that. Everything that you need to prepare yourself and to get ready for this course is in that course content tab as well. You have your syllabus overview, you have your assignment overview, and it asks and it answers key questions that you may have about your assignments. So I strongly encourage you to make sure you look around in the course content and look in advance for your upcoming assignments so that when you come to Virtual Office, you can come prepared to ask questions about the assignment. And again, I want to make sure that you're not asking questions that are already covered in the video. And I don't mind answering the questions, but I don't want you waiting for Virtual Office when the answer was already embedded in a video that you hadn't had a chance to watch yet. And if there's anything that's unclear about the videos, you can drop in the Virtual Office. So again, cannot push this upon you enough. Since this is an asynchronous course, we don't have one-to-one face discussions, whether it be a Zoom or in person in a class. That is why you cannot miss either your announcements, or you cannot miss understanding what is provided and offered to you in each week. Each week is carefully, meticulously scripted out so that you have what you need to be good every single week. Hopefully that reduces your anxiety and worry about the course, okay? So it's very important, again, that you click on everything. You know what's there for you to be successful. It's all set up for you to be successful. I did get a question about required readings in virtual office. And so again, since one student had it, or two, I think other students have the same question, and I want to clarify that. The required readings. If you notice in the syllabus, you'll see required readings from your required textbook, and you'll see that on the Blackboard as well. You'll also see a required readings folder, which has uploaded readings in there. Why do you see the difference in terms of required readings? Different reasons, and I want to use this time to explain that to you. Sometimes students do not have the book. Students were provided with information about the textbook 2 weeks before the class actually started. Class was opened up and the readings were listed. The required books were listed so students can order them in advance. There are also times when students do not come into the class until the week of, 2 weeks after, and I believe up until 3 weeks students can be enrolled in the class. As you can see from the readings in this class, if you come in week 2, week 3, you really have a lot of catching up to do for this class. And so when students are enrolled late, they didn't get the benefit of getting a chance to order the textbooks before the class started. Yet and still there are discussion boards that are due this week as well as last week. How then can they do the discussion board readings without having the textbook that they just ordered? And sometimes they can't order it to the end of the week or next week. So I have a separate folder of required readings so that students who do not have the textbook can still do the discussion boards without a problem. Adding that extra required reading folder is not to overwhelm you or make your task here any harder. It's to support those students who do not have the required textbook and cannot write to the discussion board because they do not have the textbook. Again, it's carefully thought out to help students, not to make your life any harder with the required. Now, there are also times where I may upload required readings because they may help explain the content covered that week better, easier, more efficiently than the textbook. Okay? Sometimes students are able to look at either videos or those required readings or me reviewing those required PowerPoints, and it helps demystify concepts that might be challenging, things they may not understand. And so to that end, sometimes I'm adding required readings because I think they do a better job explaining the content than the textbook sometimes. Now, there are some students that can read the textbook and follow along very comfortably. There are some that might read a particular chapter in a given week and it doesn't work for them, and then read a required reading and it makes more sense to them. Another question that I had in virtual office is, what do I use? Which reading do you want us to use for the discussion board? The discussion boards are just to make sure that you are doing the readings and that you understand the readings. In a graduate level program, we're growing you to be independent learners. You can use whichever readings you want to write the discussion board. Now, there may be times where the discussion board may ask you about specific things from the readings in which a particular reading may help you answer the discussion board. But I do not limit students on what to write on to respond to the prompt. I've had some students use readings from week 1 because they thought that it would, they wanted to discuss a concept from week 1 to answer week 2 discussion board, and that's okay too. I don't limit that. I don't have a problem with that either. So you are not limited on what readings you use to answer the discussion board. Discussion boards are in place for that I can see how you're engaging with the reading, how you're understanding the different readings. And again, you may want to use the prompt of the discussion board to talk about any particular readings that you felt were important to you. Now, in terms of getting the readings done, this course again has a lot of reading. It's writing intensive and reading intensive actually. It's important. Why? Because this course prepares you for licensure. Not just your master's level license, but your clinical license, Remember, when you get your master's degree, that makes you eligible for 2 licenses, your master's level license and your clinical. The information that you're getting in this course is supposed to help support both of your license. Once you get your master's level license, it's going to take you another 2.5 years to get your clinical license. You will still be you would have been out of the school, or you would have graduated from our program at least 2 to 3 years before you are ready to sit for your clinical license. All the information in this course is also meant to prepare you for that clinical license as well. So in that aspect, it's very important that you do all the readings to prepare yourself. Now, I do understand that you have other classes, you have other readings, and there are a lot. Yes, it's a lot of reading. It's because you're in a graduate level program. That's what distinguishes graduate level from undergraduate level. The complexity of the information and the volume of information and readings that you have to do. Please be mindful that all students do not stop at the master's level. There are many students that move forward into a doctoral program right after completing the master's level. And so the volume of reading, the challenge of this is also preparing students who are going to move forward for their doctorate. I remember when I was in my doctoral program, and I was telling my in-person class this past Monday, where when we were getting our syllabus and we had to do our readings, it was not chapters. We had to read books between one class to the next. So I'm going to say it again. We weren't reading multiple chapters in books. We had to read books between one class to the next class, and I could not believe it. However, I was in a rigorous MSW program. And so because I had so many readings in my graduate level program from my master's level program, it made that next step of reading an entire book for a class between classes easier for me. So again, there's a reason behind the rigor, and it's not just because all students are stopping at the MSW level. Some are going to the doctoral level, and they need to be prepared to read volumes and volumes of sometimes challenging information and being able to move forward. And that's doctoral level. You're not doctoral level now, but we're helping prepare you for that as well. I'm hoping that this helps you understand why the amount of readings are what they are, and how they can help you be a better student in your other courses, a better social worker, and help you be able, or prepare you to be licensed at the highest level of license that's available for what the degree that you're working on right now. And so it is very important that you do the readings. Now, the reality is there's a life that you have. You're working, you have families, you have other classes, right? And so sometimes it's very hard, if not impossible, to get through every single reading assignment. For this class, I strongly recommend that you do all of the reading assignments, even if that means that you do enough readings in a given week to write your prompt for your discussion board and reply. And then find up other time during the week that you can go back. And even if you have to use the holiday weekend, even if you have to use the next week to go backwards and catch up on the readings that you missed, it's important that you do that, because this makes the difference between students who pass the licensure or not. And I keep in contact with students when they are done with the program. And I know for a fact students who skim readings, who do not do their readings thoroughly and comprehensively, also struggle to pass the licensure. Those who do complete their readings have more success on the licensure. And I'm talking about the first time, not having to take it 2 times or 3 times. And that happens. And students have been honest with me and have said that they haven't done all the readings, and that they skimmed and they found it challenging to complete, and costly to complete the licensure, because if you fail the test, you have to wait about 2 or 3 months before you can take it again, and you got to keep paying the amount of money to retake the test, and it's not cheap. So you're here now, you're paying for your courses now. It's important that you do the readings, particularly for this class, because again, it's serving so many functions in your future career. And again, we need to make sure that we're saying that we are preparing you, and we're actually preparing you, and thus that's your readings. And so I just want to also talk to you about, the 2 things that we covered. The first week we were looking at abnormality. What is abnormality? And it's an overview of the DSM-5, our Diagnostic and Statistical Manual. And I just want to first talk about that first week first. And hopefully you got a chance to read that that article, learning your first job. It really speaks to the difficulties of graduate level work and the things that you need to do to be the best student you can be to deal with the overwhelming nature of a graduate program. So if you haven't got a chance to read it, please do. It's a reason why I start the course off with that, and it's because I understand the difficulties and the complexities of graduate level work. But we start off talking about what makes something abnormal. This is important because we don't want to see people who have challenges, particularly related to mental health, as a walking disorder. We don't do that. And as social workers, that is not our ethical stance or approach with clients. But we do need to understand when somebody or when a client is not behaving, thinking, functioning in a normal way. And so we need to first start off with is what is abnormal and why is it abnormal. Understanding those abnormalities helps us understand if we're dealing with something that is diagnosable. And then we are now put on the path to whether we should start looking at the DSM-5 to see if there's an underlying disorder that may better explain the abnormalities that we are seeing with clients. So on the surface, what constitutes an abnormality? The DSM-5 and in the clinical world, we talk about functioning, right? And global assessment and global functioning. We use terms like activities of daily living. So we want to be able to document or evaluate or assess that this client either reported or demonstrated that their level of functioning has changed. Their ability to get up in the morning, their ability to work. Think about the roles that people keep: father, mother, sister, brother, parent, employee. You want to see where there's a level of functioning that has been compromised. That is when we know that we may be dealing with an underlying disorder related to some abnormal behaviors, thoughts, feelings, emotions, etc. going on with the client. And these abnormalities or these change in functionings can occur through many levels of their life, in their school life, their academic life, their personal life, their professional life. So sometimes people who are having abnormalities or challenges with functioning may say, I cannot get out of bed, I can't cook meals for myself, I can't groom myself, my daily grooming habits, I haven't brushed my teeth, I haven't washed my face, I haven't changed my clothes, I haven't bathed. My ability to take care of myself has been compromised, my ability to care for my children, cook them dinner, get them ready, be an attentive parent for them, support them, has been compromised. That's a change in functioning. Now we're looking to see if there's something diagnosable in terms of a disorder here. And or activities of daily living. So abnormality is what we look at from the clinical world, but we also have to understand that what may be abnormal for me may not be abnormal for others. Abnormality is also grounded in culture. It's or normal. What's normal is constituted by your culture, your gender, your religion, sometimes politics, etc. There are things in which it's very subjective what we think is normal and abnormal. So from a clinical standpoint, we have to understand what is decline in functioning and understand that we're looking at the client based on their world, not ours, because sometimes we may see things as abnormal but is considered very normal in context as it relates to that family culture. Or sometimes families and individuals think things are normal and they're not. And we know it's not normal because their functioning has declined, but they just can't see how much. Now, with the DSM-5, we measure that functioning. We use terms like mild, moderate to severe. You can be mildly impaired, moderately impaired, or severely impaired. These things all speak to function, and how. So just because somebody is not functioning well, we then have to decide to what extent are they not functioning well. And we can also, again, rate that mild, moderate to severe. The DSM-5, once we're clear that there's definitely some decline in functioning, that what we're seeing is indeed abnormal and doesn't make sense in a cultural or religious context with a particular client, now we know that we may need to bring the DSM-5 in. The DSM-5 gives us the disorders, the symptoms, the categories, and it provides additional information in which to consider the diagnosis. What you'll be doing in this course is familiarizing yourself with all the different DSM-5 disorders, what groups disorders tend to be prevalent with, when to rule out a disorder, when it may be depression versus anxiety, or when it's acute stress versus PTSD. So it really helps us understand what we're looking at. So for this course, I want you to understand, you're going to start learning about the different DSM-5 disorders. One, you'll understand what the symptoms are, right? You're going to learn if there are any special implications for groups, whether groups are higher impacted, higher at risk, and why. And what are some of the social contextual challenges that may be specific to a certain disorder. So for instance, there may be disorders that women tend to be more at risk for than men. There may be disorders that men or children are more at risk for. There are certain disorders that are specific to children, and there's some that are more geared for adults. And so we need to understand what that looks like, and you'll be learning that in this course as well. But like any other clinical tool, it is not perfect. There are many limits to the DSM-5, and our week 1 readings talk about that. There have been changes to disorders. There are disorders that we used to call disorders that we do not call disorders anymore. There are things that have been removed. We use a certain cultural lens to look at clients and abnormality, and as we learn more, as we progress as a society, we have modified, and that's why we're now at the DSM-5. We've had other iterations of the DSM. Our hope is that every edition gets better and better, and our ability to diagnose and treat and support clients are better. But because oftentimes the diagnosis is the DSM-5 is created with input from dominant society, mainstream, it also serves to limit us. And so there are certain groups, particularly people of color, LGBTQ population, women, where the earlier version of the DSM-5, the DSM, tended to exclude it or to pathologize things that are culturally normal, and behaviors that we thought were not appropriate, or inappropriate, or what we would before termed as abnormal. We do not consider that until those things have been removed. And so I want you to learn about the differences and the limitations of the DSM-5. But again, it's the best that we have. It's what we use to diagnose and to get reimbursed as clinical providers. But we also have to practice understanding that it limits. People are not disorders. They are people dealing with challenges in their life that we use the DSM-5. Other challenges with the DSM-5 is over diagnosing. You may see a client with 4 different disorders. That's over diagnosing. We don't want to overdiagnose. We want to get at the right effective diagnosis that explains what is going on with that particular client at that given time. There's labeling, and then there's stigma related to labeling that comes with the DSM-5. So again, it's not perfect, but it's what we use. As clinical providers, we need to be aware of the limitations of the DSM-5 and use it appropriately to support clients and get them where they need to be. So again, week 1, really getting you familiar with what the DSM-5 is, to let you know that it's a great diagnostic tool. We use it, but it's not the only diagnostic tool we use. We also use other type of assessments like depression screens, anxiety screens, PTSD screens to help us get at improving our ability to diagnose. But right now it's gold standard and it's what we use. So right now we're at DSM-5. For this course, you need to be using DSM-5. If you use a prior version, they're outdated, and oftentimes a lot of disorders are removed, updated, and you have to be using the DSM-5. So be sure that you're doing that for this course as well. So again, week 1 is just to really get you familiar with the different disorders, and how we think about abnormality, the DSM-5, and some ways in which the different type of approaches that we use to treat, such as cognitive behavioral therapy, psychoanalytic or psychodynamic, um, dialectical behavioral therapy. We have so many different tools that we use as clinicians, and week 1 is just to give you a brief and quick overview of that. Week 2, we went over ethics and psychosomatic medicine. Ethics is a good second part for week 2 because it really speaks to our ability to ethically practice. We have our code of ethics, the NASW social work code of ethics, that govern how we go about the work that we do. And so just how we have NASW code of ethics that guide our practice in standards of practice, we also use that code of ethics in therapy and in mental health. And I kind of spoke to that earlier when we talk about understanding that we use client first language. We know that clients are clients first, they're people first, and they're people suffering from disorders. They're not walking disorders, right? Respect of the client, meeting clients where clients are, having proper boundaries with clients, making sure that we are transparent in our work with clients, making sure we don't ethically breach, which means we're harming clients rather than supporting them. And so there are ethics at play in mental health too. And week 2 talks about a lot of the ethical considerations. And there are ethical considerations about how we work with clients, how we bill clients, the administrative component of what we do, meaning scheduling, termination, what sessions look like, how long sessions are. But there are also ethics in terms of diagnosing and making sure we diagnose correctly and appropriately. And our licensing, is our way we safeguard the community to make sure that people who are saying that they're doing this work, that they have the training and education and expertise to do that. And that speaks to ethical practice. And so ethics covers so much, and week 2 goes over those areas of ethics and things to think about when we're working with client. So we want to start you on this psychopathology or this mental health journey, understanding that there are rules and standards to govern how we go about it. So the rest of the course will be talking about the disorder specifically, how to work with clients in terms of case assessment, case study, case analysis, presenting problems, and we have a lot of work that we'll be doing in this class. But the first 2 weeks is really getting you acclimated to the type of work we'll be doing in the class and letting you know that we're held to a different standard, ethically speaking, in how we work with clients. And so there's a way that we have to go about diagnosing and treating and developing intervention plans, case study plans. It's a way in which we need to engage, and it's an ethically appropriate as well as legally appropriate way. And that's what week 2 is talking about. Week 3 talks a little bit about psychosomatic medicine. And so why are we talking about that, Dr. Cross? We're talking about that because oftentimes mental health challenges present as physical problems, and you need to know about that. And also understand that the divide between the mental health and the physical health is smaller than you think. And I say this oftentimes when I'm teaching classes to students in person. If you give me somebody who has a physical medical problem, it's very easy for them to have a mental health problem, right? If I have chronic diabetes, if I have COVID-19, for example, if I have different conditions, a chronic illness that requires me to get blood draws regularly, have assessments, tests, surgeries, it's not hard to understand how that can turn somebody, or that can develop into a mental health challenges such as depression, being depressed that you're sick all the time, not losing motivation to want to get up to eat, can't sleep, all those symptoms that come with depression. It's not hard to understand how someone who's dealing with a chronic illness can become depressed or anxious, anxiety, fear, worry, thinking that they're going to die, worried about tomorrow, worried about their health. It's very easy to understand how someone who has a health condition can turn to mental health. And so we need to understand when people sometimes present with physical ailments, sometimes those means that they are at risk for mental health challenges in the future sometimes, or sometimes those physical ailments may not actually be physical ailments. They may be mental health challenges. A good way to think about that, and I've seen this and even in practice, in my private practice that sometimes clients are referred to me by doctors because they keep setting up medical appointments for physical problems. I got aches, I got chest pains, I'm having migraines, I'm having, I'm fatigued, I can't get out of bed, I keep catching colds, I'm feeling sick. They go see the doctors several times, mind you, and the doctors run up all the lab work, do assessments, and nothing. From a medical standpoint, that client is healthy. And so at that point, the doctor starts to think, maybe these physical ailments, maybe these physical complaints that this client is having is not based in medicine and physical. It's probably in the mental health world. And so then they'll send them to therapists to be evaluated. Because oftentimes pains, tense, stiffness, aches, even colds, because we know stress can make you sick and compromise your immune system. Constant repeated colds may also be a sign of an underlying health condition, mental health condition. Same thing is reversed with mental health. Mental health challenges can cause people to ultimately become physically sick too. Ulcers from stress, heart attacks from stress, other things, colds, sicknesses from stress. Sometimes poor nutrition because of lack of appetite due to stress, depression. Hair falling out from stress. Startle responses, fast heart rate, sweating, all these physiological things can happen because of depression, anxiety, stress. End of life, premature end of life through suicide. Again, we do know that mental health challenges can have the ultimate outcomes, negative outcomes for clients as well, that impact their physical health. ACEs study also talks about how adverse childhood experiences can lead to premature death. Again, that connection between mental health and the physical health. We also know that people who have certain challenges in their lives, particularly related to ACEs, adverse childhood experiences, also engage into other type of behaviors such as substance use and risky behaviors. Again, higher incidence of mental health with that as well. And so again, there's this connection between mental health and physical health. We need to understand that, and it's more closely linked than you think. Even when you think about substance use, oftentimes we're trying to figure out which came first, the substance use or the mental health problem. Is this person using substances because they have untreated mental health issues and they're trying to escape the symptoms of their mental health? Or did they begin recreationally using and it turned into a substance use problem that is now they are now having mental health challenges that are related to substance use rather than independent freestanding mental health challenges on their own? And we can talk more about that in the course, but just understand that sometimes people can hallucinate because they have schizophrenia or schizoaffective or different types of psychotic disorders. But sometimes they can hallucinate because they're on substances. So sometimes the job of the therapist is to determine if the symptoms are being caused from mental health or because of altered physical states brought about by medication or substance use. And so again, part 2 is really to have you to start thinking before we move on into the course that there is a strong connection between physical health and mental health. And so part of your job in learning how to diagnose is really trying to tease out what's going on with your client in terms of understanding what abnormality looks like, understanding if functioning has been compromised, keeping cultural context, religious context, person context at the forefront, making sure we're practicing ethically, and really ruling out other confounding variables that might explain what's going on with that client, and understanding the closeness between the relationship between the physical and the mental, and making sure that all that is at play while you're doing your diagnosis, treatment planning, assessment, and so forth. And so mental health is challenging, but this course, hopefully as you start and move along, you'll be better at understanding all these key factors as you move on. That is it for this video, but just wanted to touch base with you in week 2 to review a little bit of week 1 and week 2 content, and to hopefully answer some questions that I've had of students in Virtual Office. Thank you.